Without objection, Ms. Castor, you're recognized for 5 minutes for your opening statement.
Well, thank you, Chairman Pitts and Ranking Member Green, and thank you for calling this important hearing on the Medicaid demonstration projects. It was the Congress, through amendments to the Social Security Act and laws relating to Medicaid, that granted states new and broad flexibility to test what works. All states are different. Through what are called these Section 1115 waivers or demonstration projects, states have great flexibility to deliver care in more efficient ways. But each waiver has a time limit because demonstration projects are intended to be analyzed to ensure they are working and that they are using taxpayer dollars wisely. And there are a couple of important parameters. These are typically 5-year demonstration projects with certain extensions, 3-year extension. You negotiate with CMS. And we say that the state, and these are some of the principles, states and the federal government cannot spend more than they would have spent without the waiver, and that's an important safeguard on taxpayer dollars. So I appreciate the GAO and your thoughtful analysis of these waivers. It's very opaque to the average person. You've advocated for more transparency and accountability. Congress responded in the Affordable Care Act, and CMS has followed through with that direction, but I think we can all agree we still have more to do. So I'll look forward to your testimony today on how we can continue to work to make these demonstration projects and waivers more transparent. Now, many states have experimented with low-income pools, these uncompensated pools of cash where the local government, state governments, federal government pools money to pay for uncompensated care. Now, the uncompensated care pools are intended to support health care providers that provide uncompensated care to uninsured and underinsured state residents. They are not health care programs. They don't allow people to get primary and preventative care, and they don't protect people from financial harm resulting from medical debt, and that's why they've come under great scrutiny. They were very important before the adoption of the Affordable Care Act because the uninsured levels across America were so high. Hospitals, doctors, community health centers simply couldn't cover the cost of uncompensated care without the help of the low-income pool dollars. And these were especially vital to the state of Florida as we transitioned from traditional Medicaid to Medicaid managed care. And I was an advocate in past years for very healthy, uncompensated care pools. But now we're in a whole different world. With the broad expansion of coverage under the Affordable Care Act, these billions of dollars in pools of cash don't make financial sense anymore. So CMS put states on notice some years ago. They put Florida on notice in 2011 that the low-income pool would not survive in its current form because it doesn't make sense to simply write a check to a hospital or a state that isn't as financially responsible as providing coverage to your citizens. After being on notice since 2011, Florida got a 1-year extension of the LIP until June 30th, 2015, with the understanding that it would conduct an independent review of its payment system intended to allow for the development of a sustainable, accountable, actuarially sound Medicaid payment system, and the LIP would be different. Florida knew that it was expected to change the way it pays providers and provides health services to its low-income residents. They got into trouble this spring because the governor, even though he was on notice, included the full LIP uncompensated care pooled number in his budget. And the Republican-led state Senate wanted a coverage model. So they went into a budget impasse. And fortunately, they have resolved it. Unfortunately, they did not adopt a coverage model. And we're on notice that the LIP funds are going to diminish over time. This will be an important lesson for other states across the country. And we need to focus on coverage that's more financially secure for states, the federal government, and eliminate this risk of unnecessary expenditure of taxpayer dollars. So I'll look forward to the discussion on that today as well. Thank you very much. I yield back my time.